My name is Dr. Theta, and I am the chair of the San Fernando Valley International Awareness and Involvement Committee. And this year, we wanted to focus on the frontline workers who are doing the work to fight and combat the epidemic of AIDS, HIV that we are still experiencing in our country. And we want to remind you to rethink, to rebuild, and to rise.
Misconceptions that we have within our Black and Brown communities are the following. One, we're so busy focusing and thinking that this will not happen to us. We're still thinking about this as a gay white male disease, and instead of realizing the numbers are staggering within our communities, and we need every one of us to be tested.
My name is Brittany Swan. I work with AIDS Healthcare Foundation. I've been with them for 7 years now. I currently work as an associate director in human resources, and I also chair our affinity group, Black Leadership AIDS Crisis Coalition for the state of California.
My name is Fallon Nelms. I'm the proud chapter president of the San Fernando Valley Alumni Chapter of Delta Sigma Theta Sorority Incorporated.
I initially was drawn based on my goal has always been to be of service. Being in the realm of HIV and AIDS, I did not know much about it until I joined the organization. I knew of it, but I didn't know how it's affecting so many individuals and how so many do not know how it can affect us. There is a deep stigma around sexual health. And so getting deeper into that um, made me want to continue to work in this field.
World AIDS Day is important to me because I can't believe it's still an epidemic. And I can't believe that it affects the Black population as high as it does. We are still dying from this disease. We're still getting this disease. So it is highly important, and I'm still overwhelmed with information that we're still learning about AIDS. So that is why it's important to me.
My name is Dr. Linda James. I am a family practice physician. I'm a member of Delta Sigma Theta Sorority Incorporated, San Fernando Valley Alumni Chapter. Approximately 1.2 million people in the U.S. are living with HIV. About 13% do not know they are infected. Approximately 35,000 new infections occur each year. Black Americans represent 40% of new diagnoses, but only 12% of the U.S. population.
Latinos represent 29% of new diagnoses as well, and those numbers are growing. People can live longer with HIV as long as they know that one, that they are positive, but two, as long as they're keeping up their medication, they remain undetected. So that's why it's important for times like this, like World AIDS Day, and just individuals in the community to speak on the knowledge and just educating, making them aware of the different sites that are available to them, some of them bringing free services altogether so that they can get tested.
This World AIDS Day is important to me because it makes me reflect on family that I've lost due to this disease. I have a cousin who passed away from AIDS. She was 10 years old. She suffered her entire life, and her funeral was the saddest funeral that I had ever been to. I, at the time, I was young, and I didn't know that kids could pass away. I didn't even know that kids could be so sick. And she had AIDS because it was passed to her from her mother. And this was at a time when they didn't have medication to prevent it from being transmitted to from mother to daughter. And
My name is Dr. Marnisha Mintlow. I am the co-chair of the Social Action Committee at the San Fernando Valley Alumni Chapter of Delta Sigma Theta Sorority Incorporated. When thinking about social action and HIV, I think about supporting equitable access to care. We can make sure that we are registered voters and that we can vote when these healthcare bills and options become available on our ballot, that we vote to support to ensure that all people have access to care. When I think of rethink, rebuild, and rise in regards to HIV and AIDS, I think that we need to rethink the current stigma that is around HIV and AIDS. I think we need to rebuild our mindset for a new narrative on what HIV and AIDS does and the impact that it has on our community. And we need to rise and come together and ensure that everyone has equitable access to care.
So when I hear the term rethink, rebuild, and rise with regards to World AIDS Day, I personally and professionally, I had to think about life balance myself. Because first, I put professional and thinking all the things I wanted to accomplish with regards to that, with regards to World AIDS Day. And then realize I'm not doing what I tell my patients to do, is to focus on your life. So I'm going to take some time to rethink about what I'm doing, put together my 10-year plan for the next 10 years, because I don't want to be a physician that dies at his table. Too many of my colleagues have done that by working too hard. And professionally, we are building, we are growing, we are thinking about ways in terms of reaching out not just individuals that come to our office, but individuals around our offices as well. Working with community-based organizations that need our support, particularly those that are working with individuals who are undocumented. Working with mental health providers as well too, because there's that intersection between HIV care and mental health that is so important. If we're talking about depression, anxiety, we're talking about schizophrenia, and we're also talking about drug abuse as well too, substance use. So building those type of correlations.
My name is Belinda Redding, and I have been a registered nurse since 1987. And I have gone through several pandemics, several disasters, per se. I was around when HIV came along and all the buzz was in a hospital. But now we're in like 2025, and AIDS has been around so long, we need to rethink how we treat these patients. We need to treat everyone as if they have AIDS, and that's what we're taught. So it shouldn't be any whispering when we get a patient that's HIV positive, because we treat everyone the same way. So it's time for us to rebuild our thought process. It's time for us to just sit back, continue to educate ourselves, and be confident in the work that we do. So let's rise up, educate, communicate, and let's eradicate HIV and AIDS. Rethink, rebuild, and rise.
Rethink, rebuild, rise.
Rethink, rebuild, and rise.
Rethink, rebuild, rise.